Hi everyone, welcome to Out of the Box Physical Therapy again. I was just talking to my wife about the situation yesterday that I had with a patient earlier this week, and I thought it'd be a good topic just to talk about. I basically wanted to talk about those situations with patients when they really unload their burdens on you. Let me tell you the story about this particular patient. So this patient of mine had a stroke back in September, and a pretty serious one, but she's been making a really solid recovery, and she's been with me now for about 4 or 5 months actually. She's been doing really good. She's always very upbeat, very energetic, really optimistic. I mean, she's a great patient. But the other day she was having a rough day emotionally with just the way the stroke has affected her body and the fact that she doesn't have answers for everything that's going on. You know, just those weird symptoms that you'll see sometimes with patients that have had a stroke, and there's just not always a great answer for the symptoms. And I mean, she was angry. She was angry, and she was just like, you know, I was doing everything right. I was eating right. I was physically active. And why am I the one who had the stroke? I see all my friends, and they're eating like shit, is what she said. And I'm the one that got a fucking stroke. You know, like, that's what she said. I was like, I mean, she just unloaded on me, right? And I was, like, kind of stunned by it. Like, I didn't really know what to say. And even she was like, I'm sorry, I'm not angry at you, I'm just angry at my body and the situation, but, you know, forget about it, let's just keep doing PT. And I decided to, I decided to say, like, no, like, let's talk about this a little bit more, you know, and I was like, you know, you have a right to be angry, you have a right to be upset about this, you know, you had this, event happen in your life that changed your health, and it's changed the way that you're living your life, and that's upsetting, and you're allowed to cry about that, and you're allowed to be angry about that sometimes. You know, don't let those emotions control you, but you're allowed to feel like that. And you know, I think it's good sometimes, first of all, when a patient is really unloading those kinds of emotions, to listen. Like, try to just take a step back and listen to them and let them get those thoughts and feelings off their chest. And like, sometimes you're not going to have the right answer per se. Like, you're not necessarily going to be able to answer those frustrating questions that they have. And I think sometimes it's good to just tell them that you don't necessarily have an answer for their questions, but that you're there to listen, and that they are absolutely allowed to feel like that, and that it's normal to feel like that. And thankfully this patient is in a support group for stroke patients, for patients who have had a stroke, I should say. And I think she's seen them this week, so it'll be a good timing for her to unload some of that with that and process some of that with them. And you know, like, she even took time, as I let her just keep talking, to mention that she feels like she has to be strong all the time, and that she's not allowed to be sad, and she's not allowed to be angry, and that sometimes she feels like she just needs to be sad and she needs to be angry. And I told her to go for it, to take time sometimes to really allow those emotions to take place, and not to try and cap it off and hold it all in. And I definitely encouraged her to talk to her support group this week about what she was feeling. And yeah, we just had a little powwow, and I think it went really well, and we continued therapy afterwards. But it was heavy. It was really heavy. Even I felt emotional, which I don't really get particularly emotional a lot of the time with that kind of stuff, but like, I felt emotional about it, you know, like, just hearing the rawness of her experiences come out. And I just wanted to bring this topic up with y'all. You know, when a patient unloads their heavy burdens, what do you do? How do you handle those situations? And even in this situation, would you have done something differently? if a patient said something like that to you. And I just want you to take time this week to think about that. You know, the times when a patient is talking about things going on in their life. I think it can be frustrating. Sometimes they're almost distracting in our PT minds to be thinking like, oh, we need to do treatment, like we're spending too much time talking. Sometimes that's the case. Sometimes you have to keep a patient on track, but I think sometimes you just need to let a patient talk and get that kind of stuff off their chest, because they're not going to do well. They're not going to do well that day in treatment anyway if they have all that inside of them. That's my opinion anyway. What do you think? What would you have done differently? And if you've maybe not been handling those kind of situations very well as a PT, how are you going to break out of that box? Talk to you next time.